So welcome to the Health Evolution Collective. My name is Tracy McBeath, and today I am here with Dr. Amy Imms. Welcome, Amy. Thank you for being here.
Thank you so much for having me.
Well, I've been so excited to chat to you and get to know you. Of course, the wonderful Dr. Lucy Burns introduced us, and
Yes.
I think primarily because we both got 5 kids.
Yes, too many.
Too many, I know. And I heard that, and I have that out-of-body experience, like, wow, that's amazing. How do you deal with 5 kids? And I'm like, oh, yeah. You just do, don't you? But
feels normal.
Life, no, never a dull moment for you, though, hey?
Yeah.
So your passion is something that's very close to my heart. So you have you're a GP as well, but you have a project, if you like, called the Burnout Project. Do you want to just explain a little bit about what that is?
Yeah, so I don't work as a GP anymore, but that's sort of where it came from, because I was seeing a lot of people with burnout, and I was really interested in helping them with that. And because they didn't have, a formal mental health diagnosis like depression or anxiety, and didn't kind of go down that standard pathway of seeing a psychologist or getting a mental health care plan. And so I was looking at how can I actually help these people and get them to actually seek that help before it gets really bad. And so that's when I started doing this work in particular. And so through the Burnout Project, there's a range of things. So I do burnout counselling, which is a little bit like what I would have done in general practice, but with longer appointments and, really focusing in on that. And then I have Burnout Packages, which people can order either for themselves, or quite often it's people ordering them for somebody else that they're worried about, because sometimes the person who's actually burnt out doesn't want to kind of acknowledge it or face that there's a problem, but maybe people around them who they work with or care about them can see that they're struggling. And so that's something that they can do that kind of feels like it's practical and actually going to help them a little bit. And then the sort of education side of things for people who are feeling burnt out, or for workplaces trying to work out, how can we care for our employees and look after their well-being for their own sake, but also for the sake of that organisation or that business, and having people there who are productive and contributing how they want them to the business.
Fantastic. Such an important message. So I'm so glad you're here. So what are you going to share with us today in your little presentation?
So today I'm going to talk particularly about energy levels and exhaustion, because that's one of the really big elements of burnout, and a really tricky one to get past when you're looking at overcoming burnout. That takes a little bit of energy to actually, put effort into that recovery process. And so how do you kind of get past that block of not having that energy and motivation to do something about it?
Oh, awesome. Well, I'm going to leave the screen now and let you share your knowledge, and then I'll come back at the end and have a few questions for you, if that's okay.
Great.
All right. I'll see you soon.
Bye. Right, so as I was saying, one of the main symptoms that you get with burnout is this profound kind of fatigue and exhaustion. You just feel tired all the time. And you might feel particularly tired when you're about to go to work, or when you're at work, or it might be something that affects you, day in and day out and all the time. And there might be things that you used to love to do, maybe playing sports with a team of friends, or maybe you did things like drawing when you had a few moments to yourself, or reading novels, or doing things with the kids, playing a board game or reading to them, or something on a weekend like going for a bushwalk. But these are the kinds of things that, as you become more and more burnt out, then you just feel too tired and you can't engage with those things. You just don't know how you can find that extra little bit of energy or interest in those kinds of things that you used to do, and you feel so depleted by all the other pressures that you have going on in day-to-day life, that those extra things, the added things that aren't essential but are often what sort of really feeds us and give us what we want from life, and they're those things that tend to drop away first. So when we look at the research into burnout, it identifies exhaustion as one of the 3 main elements that we see, and it's often that first one that people notice. So this is the International Classification of Disease, and they define burnout. They talk about it as being a syndrome resulting from chronic workplace stress that hasn't been successfully managed. This is one area where I disagree a little bit. It doesn't have to be related to work. We see burnout all the time related to activities that might be a primary role for us, but they don't give us any kind of financial gain. So caring for children, caring for kids with special needs, study, volunteer work, all of those sorts of things we can burn out in as well. But the next bit is really good. So when it's here talking about these three main elements that people notice, so there's the exhaustion, which we'll talk about today. The second one is a feeling of cynicism and often sort of an irritability and withdrawing and socially isolating. And then the third one, reduced professional efficacy. So this is, again, not professional, but just in whatever role that we're talking about, a feeling that you're not so good at that role, or you're not accomplishing what you want to with it, or it doesn't sort of mean anything, those kinds of feelings. But I want to focus on exhaustion today because I think that's often such a prominent issue that people notice and want to start trying to get some energy back. So firstly, it's just really important to actually acknowledge that there's that lack of energy there and there is that fatigue, that it's not something that's just kind of in your head and you're just kind of imagining it, but you really are exhausted. And it's okay to acknowledge that, and it's okay to have a time where you need to take things a little bit easier and have a bit more rest than usual. Or if you've got a whole bunch of different commitments, often people just try to push on with them because they feel like they should, but actually going, no, you know, things are at a point where I actually need to take that time to cut back a little bit, and, you know, can I postpone things or delegate things for a little while, or take a bit of a break and actually allow that chance for you to recover. So as burnout worsens, then our stresses mount, and when that happens, then your body is spending more and more time in this activated kind of stress response. So we get this fight or flight part of your nervous system that helps your body to prepare for those threats and look out for dangers. And then you get all sorts of hormone pathways that are activated. So things like adrenaline and cortisol, for example. And so these are making your heart beat faster, they're making your blood pressure go up, you might breathe faster, it's releasing some extra sugar, your digestion gets altered. So it's all these sorts of things that it's trying to get you prepared to fight these stressful circumstances, these threats that it's detected, and not be so worried about the other less essential things. So things like just your digestion and your immune system kind of get put on the back burner for a little bit. And so the end result of this process going on and on over time is this significant fatigue that people experience. And stress in general, it's not always a bad thing. So sometimes if people have a little bit of stress, then that can actually help them function a bit better. It can help us concentrate better and think more clearly. But it's when it gets too much that it becomes a big problem. And obviously, if you're actually in real, physical danger, we're talking about a threat, which is actually, a lion coming at you, or you're trying to escape a fire or something, then we want all those things happening. We want blood going to our muscles so we can run fast, and we want our heart pumping faster so that we can get more blood to our brain and think about how we're going to escape and all those sorts of things. So it's evolved as a mechanism, which is really helpful. But the way this happens in the modern world is usually to more perceived threats. So we don't actually have a physical threat there, but we're worrying about something, or we're thinking back over something that happened. We've just got too many different things on that we have to do, and that's activating that same kind of response. Our body can't tell the difference between those things, between that true physical threat and something else, which is something that we're worried about. So for some people, actually taking more rest is going to be something that can help to deactivate this kind of stress response. And particularly if you have a job or a general day-to-day role which requires a lot of physical activity, then just making time to actually have that physical rest is going to be really important. It depends a little bit on your job though, because on the other hand, if you do something day-to-day where you're just sitting all day at a computer or something like that, then actually introducing some kind of general regular activity is going to provide that energy. So exactly what you do is really going to be quite unique to your situation, but you essentially want to be trying to introduce activities that are going to deactivate that stress response and activate what we call the rest and digest response that you might have heard about before, where we get different hormones that are released that have, in a lot of cases, the opposite kind of effect. So that's the first thing, is just letting yourself acknowledge that there is a problem and that you are allowed to respond to that, that it's okay to take those measures and look after yourself in that way. The second one that I wanted to talk about is sleep. So when we're burnt out, we often have difficulty getting to sleep. So you might lie awake thinking about things from the day you've just had, thinking about things that you said or things that people did, things that didn't really go very well. Maybe you're worrying that you forgot something during the day. You might be worrying about things to come, so worrying about things tomorrow, things that you've got to do and that you can't forget to do, or things that are coming up in, weeks or months' time. But we spend a lot of our time doing that just generally during the day. So about 80% of the day is spent worrying about other things that are not the present moment. And so that can be particularly prominent at bedtime, when we're just lying there with nothing else to distract us from all of those thoughts. Or you might actually drop off to sleep okay, but you're waking up at 3 o'clock in the morning or 4 o'clock or 5 o'clock and having difficulty getting back to sleep. So again, maybe you're thinking about all these kinds of things. And you might particularly notice that if you're using something like alcohol or medication to get to sleep, those things can help you drop off, but they don't tend to keep you asleep very well. This early waking can also be a sign that there might be something else going on, like a depression alongside of burnout. So it's worth keeping an eye out there and just seeing your doctor and just making sure that there's not something else going on. For some of you, maybe you're actually getting to sleep okay and sleeping through the night, so that sort of duration of sleep is fine, but you might wake up still feeling exhausted, so you're not feeling refreshed by that sleep. And so then it's the actual quality of your sleep. So you're getting enough quantity, but you're not getting that quality. And so again, this can be affected by things like alcohol and medications, and also a range of medical issues. So things like sleep apnea, for example, where you're actually having times that you don't recognize during the night where you're actually stopping breathing. So there are all sorts of things there that can reduce that quality of sleep that are related to burnout, or might be just something else which is happening as well. Sometimes sleep just feels like a little bit unnecessary, that it's something that we have to fit into our day just because we get tired and we have to do it. But we might wish that we didn't have to. That how great would it be if we had another 6 or 7 or 8 hours every day to just get things done? I know I've thought that before. Or maybe actually get some time to ourselves to do those things that we want to do that we never get time for because we're working or looking after other people's needs and putting other people first. But sleep isn't just an inconvenient thing to stop ourselves being tired, but it has all sorts of really important functions for our body. It's a time when our body repairs itself, so we get things like muscle repair and muscle growth and tissue repair. And it's also really important for our minds. So particularly when we're learning new things, it's a time when those new memories get consolidated so that we can actually recall them later. So if we're not getting that sleep that we need, then all those body functions which rely on sleep to happen aren't happening. And so that's going to affect us. So we end up with this kind of cycle where we're really tired all the time. Our mind doesn't take in information as well, so we're often sort of quite distracted and can't really focus on those things that people are trying to communicate to us, what we're trying to learn in some way. And then we don't get enough sleep, so those memories don't get consolidated. And then when we're trying to recall that information, again, we're tired. So our neurons, our cells in our brain, which we rely on to recall that, they don't work as well when we're really tired. So we get trapped in this cycle where things just get worse and worse when we've got sleep problems and sleep deprivation happening. So the third thing is just thinking about our daily routine and our schedules and what we're doing with that time and how we're communicating with people. So it's important that we look at, if we've got this limited energy, then what are we actually giving that to each day? What kind of interactions and social engagements and how we're using that time. And this is particularly important in these early stages of burnout, where it's arisen because usually it's because we've got too many demands upon us and we don't have enough resources to meet it. So in that immediate term, they're the two things that we can look at is, first of all, how are we going to reduce these demands upon us? And then how are we going to build those resources? So in terms of reducing those demands, what do we actually have on each day in our schedules? And is there anything that we can cancel that isn't essential for us? Things that we can delegate or postpone, things that we might think of as quite important and something that we don't want to let people down with, for example, if we stop. But the reality might be that, the world isn't going to fall apart if we stop being on that committee or stop leading some group or something like that for a little while. If our kids eat different food for a while because we need something that's easier to prepare or whatever it might be, looking for anywhere that we can make those changes. The second one is looking at the timing of what we do. So what times of day do we actually have the most energy? In general, we can't keep up really high energy levels and concentration of focus for an entire day, 8 hours a day or 12 hours a day. We're looking at more like having 3, 4, 5 hours a day, especially when we're burnt out. That's going to be a shorter period of time. So what are those things that we need to get done in our day, which take a lot of cognitive energy, so we really need to think clearly about them, or a lot of emotional energy? And when are we doing those things? Are we the kind of person who has the highest energy levels first thing in the morning or in the afternoon or evening? Those are less common. Most people find the morning the best time, but is there some way that we can put those tasks into a time of day where we're most likely to have that energy to meet it and complete those tasks or engage well in those environments or those types of communication? And the third thing here when we're thinking about our daily routine is the boundaries that we set. And this is such a big issue that a lot of people really struggle with, and it applies to so many areas of our lives. So there's all sorts of boundaries surrounding work, for example, and how do we manage our daily tasks? How do we delegate tasks when we're asked to do things? How do we say yes or no? And do we respect our own capacities? If we've already got too much on our plate and somebody asks us, can we do something more? Do we just say, oh, yes, of course, and then think, oh, no, what have I done now? And how am I actually going to do that? Or are we aware of that and actually have a way that we can communicate that information to the person who's making that request so that it still works well and can still get done in some other way, but maybe it's not you who can take that on right then? And then boundaries around after work time and, actually being able to switch off. And do you receive work calls or work emails after hours, for example? And is that after work time a time that you can actually engage with family or hobbies or whatever it might be that sort of gives your life meaning outside of work? And what boundaries do you need to put in place there? And then with other people, so both socially and at work, the way that you're treated, for example, do you have boundaries around the way that people ask you to do things? Some people are going to be in environments where there's things like bullying and sexism and all those sorts of things as well. So just thinking about, are there ways that people are overstepping boundaries, and what are those boundaries, and how am I going to enforce that? And is there a phrase that I can use or a way that I can do that so that I don't feel uncomfortable, that it just becomes a natural part of how I can respond to things, to protect that time and energy and get that kind of respect for your own time and your own value? So just to go through those again. So first of all, accepting that there is fatigue there, that you can't just keep on pushing on as if everything's fine, acknowledging that you're exhausted and that that's okay to have to modify things for a while or even forever while you address those problems. And then secondly, valuing sleep as a restorative tool, so for your mind and your body, and realizing that you can't just work all day and all night and still function well, that you have to let yourself rest and rejuvenate. So that you can do those things that you want to do to the optimum, to be able to give it everything that you want to. And then thirdly, looking at the daily routine and your schedules and your commitments and your relationships and your boundaries. So there's actually, if you want to learn a little bit more about it, there's a burnout scale that I've made that you can see on the website. And that just helps you to have a bit of a look at how burnt out you are at the moment. So there's 30 elements of burnout, signs of burnout, and looking at how much is that affecting me right now. And this is sort of like the acknowledgement stage of looking at this exhaustion, you know, actually seeing that in front of you of how is burnout affecting me and to what degree, and seeing that there in more black and white in front of you, so that it can then be something that you can manage. And especially for people who end up with a high score for that kind of thing, that can be a little bit confronting. But realizing that, yes, you know, this might be really showing you that things are really hard right now, but the good news is that we know that people can overcome this, that you should have hope that with guidance and with support that you can get through that. And without that initial acknowledgement, then you can't sort of embark upon that process. So see that as a positive thing of actually seeing, you know, how bad are things now and what can I do about that next.
Yeah, thank you so much for that. That was great, and something that I'm so passionate about as well. It's almost daily now. I will come across someone who, you know, I think we're just really starting to see the impacts of stress and you know, and how it can lead to something like burnout. And I love your burnout scale. So I highly recommend people, if you're watching, to go and have a look, because I just think it's something that we push to the side. And, you know, I think you sort of touched on this, that we don't want to acknowledge, you know, when we're heading down that track.
Yeah, and I think partly it's because we just think, oh, you know, this is just busy modern life and this is just the way it is, and sort of accepting that there's probably nothing I can do about it. Or on the other hand, people are really good at hiding it. So sometimes people feel like, well, everyone else around me has got it all together. What's wrong with me? And you know, why am I struggling? And so then not wanting to speak out about it, and not realizing that actually probably half the people around you are struggling as well. I mean, the Australian statistics are something like over 25% of Australian adults are showing a lot of signs of burnout. So chances are, yeah, a lot of friends and colleagues and co-workers are struggling with that as well.
Yeah, and the implications for that, you know, on our health are just huge. You know, I was just talking to a doctor who, you know, her passion is autoimmune, and, you know, she was saying how for her, she has endometriosis and autoimmune, and she didn't even know she had it, but all the symptoms came to the fore when she went through a serious, you know, stress issue, you know, in her life. And, you know, that sort of brought it on. And, you know, it's kind of like, I was sitting here while I was listening to you thinking, if you were in, you know, from a practitioner's perspective, if you had someone come and see you, how do you know? Where do you start? Because could it be, you know, health related, or is it it's like the chicken and the egg? Where do you start with seeing what the real issue is?
So you mean when they come with certain symptoms and differentiating?
Yeah, because yes, because a lot of those symptoms you talked about could be, you know, from something else.
Absolutely. That's such an important part of it, because there is such an overlap with both physical and mental illnesses. So I always say the number one thing that you need to do if you think you're burnt out is to see your doctor or whoever your normal health provider is, and actually get that sorted out first. You need to get tested for things. You know, the number of times that I've seen people with an anemia or a thyroid disorder or something causing their fatigue, but they think they're just burnt out, and maybe they are burnt out as well. But unless they fix those other problems, they're not really going to get anywhere with managing the burnout. And likewise, if someone's got a really severe depression or anxiety or, you know, another mental health disorder going on, then again, yes, those burnout measures might help, but you're not going to get that level of progress, and you're going to need to at some point deal with it. So always getting checked, making sure that you've got a doctor or somebody who goes through all those symptoms and thinks about what else could be causing this before you go on with dealing with burnout.
Yeah, look, I love that. I think there's just so many pieces to the puzzle, and, you know, we don't need to be overwhelmed by that. I think we can see that it just means there's you know, there's lots of things lots of opportunities and lots of things that we can look at, but, you know, it's important to acknowledge it, you know, as I said at the start, you know, not to just pretend that it's a part of modern life, because like so much in modern life, we put it down to, oh, because it's common, it must be normal.
Yes.
You know, yeah, and I don't
that's
think
not true.
No, that's right. And yes, I mean, you and I are the first to sit here and say, okay, we're moms, we've got our own business, we've got 5 kids. Okay, there's, you know, it's full on. There's a lot going on there, but there's still so much room to see, and a lot of those things that you said in there, you know, there's a lot of space to see how we can do things differently. And the boundaries one, so important, and particularly for women, because we don't like saying no, and we think that, you know, that you know, maybe they won't like us, or what will they think of us, and you know, we kind of like to please. And again, I think there's a lot of space to see that, you know, you don't have, you're still lovable, they will still like, you know, like, you don't have to say yes to everything. You have to really put it in the context of what's going on in your life.
Absolutely. And that's why finding a phrase that works for you to enforce those boundaries is so important, because it doesn't have to be done in a way that creates some kind of conflict or offense, but there are always ways to communicate that in a way that keeps that relationship there and keeps you feeling comfortable. You know, if it's important to you to feel liked, for example, then that doesn't mean that you have to completely push against that to maintain boundaries and become some kind of stronger, more authoritative kind of person. Yeah. And I think what you mentioned about it can sometimes feel like there's a lot of things to do. And I think people do sometimes feel really overwhelmed, that they think, you know, I feel completely exhausted and burnt out, but to actually fix this, you know, what am I going to have to do? Am I going to have to somehow go to the gym 5 times a week and change the way I'm eating and do all these different things? And it's not like that. Often, if you really tailor it to that individual, and, you know, when I'm working with people with counselling and really get to know their issues, then it's actually often 3 to 5 small changes can make a whole world of difference.
Isn't that amazing? I love that. And I think I see that too. You know, we think it is, you know, oh God, they're going to tell us that I can't eat this, or I can't have a glass of wine, or, you know, like, yeah, exactly what you said. But, you know, often it isn't that. And I think, you know, when you can tell there's something that is right for them, right for their lifestyle, there is a lot of freedom around, you know, still having the things you enjoy, but in the context of where you want to be and where you want to get to. And, you know, I liken it to, you know, if it's like, I don't know, like where you are now, is that sustainable? You know, if you're chronically tired all the time, is that sustainable? And I think, you know, just having the courage to see that, you know, I can try something new, I can try different things, and I will get different results. And
absolutely.
Yeah,
and
awesome.
especially if the response that you feel like you need to do involves something a little bit bigger, like changing jobs or cutting back on work or something like that. You know, it can be a little bit more confronting in a sense than those changes like diet or exercise or doing some mindfulness or something like that. And they're the kinds of things also that you expect some kind of opinion from other people, where everyone's going to tell you what they think about having, you know, left your job or something like that. And so particularly in those cases, having somebody else to talk to and acknowledge that struggle and sort of reinforce that, you know, yes, maybe that is something that's worth considering, can be that little push that people need to actually take actions that are going to make a big impact on their life. And so they're not so stuck in, I just have to do this because this is what I do and this is what everyone expects from me.
Yeah. Oh, there's just so much we can see. So much new stuff we can see. That's fantastic. So to finish, I was just hoping I could ask you a little bit around, you know, you shared at the beginning that, you know, you've seen in your work as a GP, you know, that it is a problem, that it is something that you wanted to, you know, do more work in. I just wondered, you know, was there any sort of personal sort of story around that for you? Because often when, you know, and there might not be, but often, you know, we come to see change from something that has been driven from, you know, something in our own lives. Was there anything around that like that for you that you're happy to share?
There was, absolutely. So as I say, I had developed this interest already earlier in my career, partly because there's a lot of burnout amongst doctors. So I'd seen it amongst my colleagues right from the beginning, and then in general practice, seeing it in my patients as well. And so I really enjoyed that aspect of my day-to-day work. And then I hit a point where I'd had about a 6-month period of just all sorts of different stresses. So, for example, I'd been supporting a family member through cancer treatment, and I had my own health issues, which were not really making much progress with at the time. And then it hit the anniversary of my best friend had died in a car accident. So it was the anniversary of that. And then I also found out that one of my patients had taken their own life. So just this culmination of all sorts of things that came together at the same point that really led to, if I look back over my life, that one point where I was sort of rock bottom and really struggling. And I was also working with 4 kids and the main breadwinner of the family. So there was a lot of pressure on me to keep doing that as well. And through that process, I really started to question, everything. And is this really what I want to be doing? And it probably took me about another 6 months after that to work through all of that myself and realize that, this is an area that I really care about and I'm passionate about it anyway professionally, but now I've seen it myself as well, and I know how hard that is. And this has taken me 6 months to, get through it. Can I help other people get through that without that sort of really long kind of meandering kind of process that I took, but getting some more support and guidance, because I struggled to find really the kind of support that I needed in the traditional sort of medical system, I guess, with GPs and psychologists and things. That they were helpful, but they just weren't quite what I needed. So I went about trying to create something that I would have liked back then. So yeah, that was my sort of personal journey that led to starting it all.
Oh, thank you for sharing that. It's I just find that there is often a story behind why we do what we do, and the women I talk to, yourself included, that drives the passion to help people. As I said, predominantly what we want to show is that there is options, and life is going to happen. There is going to be events in your life, in everyone's life, that is hard and sad, and I don't think we can find anything that's going to not expose us to that, but there is certainly options on how we deal with it and how we confront things. And I think you've just done a beautiful job today sharing and showing us that. And I will put obviously all your information below for people to go to your website. I'm going to go and have a look and do that and do your what was it? The burnout scale. Yeah, I'm going to go and have a look. And because I've got a bit of a cold this morning, and I said to you before we started, I don't normally get sick. I've got a bit of a cold, and I think sometimes we can just get on that treadmill and keep going, and we don't notice the little nudges and the signals that our body sends us to say, hey, maybe you need to just slow down a little bit and take
Absolutely.
a weekend off.
Yep. And sometimes it is something little like that, like you say, getting a cold, or something that's kind of out of the ordinary, that a lot of the signs of burnout just sort of creep up really slowly, and then something happens, you go, oh, that's not really quite normal for me. What's going on there?
Yeah, and that's right. And, so one of the things that I hear a lot is that, I couldn't possibly slow or take some time off or stop because, everyone's relying on me. And it's like, well, you're not really much good to everyone if you're completely burnt out anyway too. So it is out of love for yourself and love for everyone around you that you do acknowledge all this sort of stuff in yourself. And
absolutely. And when we imagine that impact that it's going to have of us cutting back, we think it's going to have this big impact, but people adapt a lot more than what we think we do. So I don't think it's ever as bad as what we imagine in our head.
Oh, how often is that the case with so much, this with a little thing in here that just tells us all these things, and tricks us all the time. Excuse me. Excuse me. Well, thank you again. It's been great and lovely to meet you, and thank you very much for sharing your wisdom and your knowledge. And if anyone wants to get in contact with you, obviously they can do so with the links below. Thanks so much, Amy.
Thank you so much for having me.
You're welcome.